Good morning, everybody. It is time for the Orthopedic Minute with our good friends from DMOS. And joining us in studio right now is Dr. Lee Evans. And he is going to talk a little bit about something that a lot of people have gone through and experienced. Plantar fasciitis, doctor, and this is something, first of all, let's explain what plantar fasciitis is, then we can talk about the different things we can do to help alleviate some of the pain.
Sure. Plantar fasciitis is an inflammation of the ligament that attaches to the bottom of the foot, and that ligament's a really tough, broad ligament, and it runs from the bottom of the heel bone out to the toes. It's got its best attachment, though, at the bottom of the heel, and so that's where it always gets aggravated.
Right.
So what causes this? Because I feel like you're hearing a lot about it in different ways of alleviating this pain, whether it's something you should put in your shoe or maybe something that we need to come see you about. But what essentially, is it because we're on our feet all the time? Is it age? Is it weight? What causes
We
this?
talk about a change, so change in activity, change in a job, a change in a shoe. Someone who's been a light jogger and now is going to run a half marathon. So that change in their activity level is hard on their feet. A change in seasons. You know, we live in Iowa, so we come out of winter where you're in a closed shoe all winter, and now you go to spring and summer when you're in a flip-flop and you're in a sandal. So just that change in activity.
And what does it take to aggravate this? Is it the plantar fasciitis? Is it a ligament, you said? Is that what it's called?
Sure. So ligaments attach bone to bone and tendons connect muscle to bone. Well, this is a ligament. It connects the bone of the bottom of the heel to many different structures in the bottom of the foot. And so its attachment to the bottom of the heel is the toughest attachment. It's where we strike every single step. We strike on our heel.
Sure.
And so it gets aggravated and inflamed.
So literally by just changing something in our lives when it comes to our feet, it could aggravate this to the resulting in pain.
Absolutely. If you're going to go from, you know, being a walker to a jogger, from a jogger to a runner, someone who's going to be a jogger and then they want to do a triathlon, so now you're on the bike and you're running and you're swimming. So all those kinds
Speaking of bikes, what about biking? Does that have any tendency to damage this ligament at all?
Sure, you know, we're talking about RAGBRAI right now.
Yeah.
We'll see a fair amount of people that come in after RAGBRAI with plantar fasciitis because they've gone to being from a recreational biker on the weekend and now riding, what are they doing, 87 miles or something like that today. And that change, that increase in activity level is a problem for them.
Now, is it gender specific? Is it more prone to be something the guys get or the gals get? Or?
So we see plantar fasciitis in all sizes, shapes. Pregnancy, for example, you gain a significant amount of weight in a short period of time, and then you lose that weight again. The kinds of shoes that you like to wear, the styles of shoes I like to wear. You know, I walked in today and I saw how beautifully dressed you were, but then I look at your shoes and you've got a little heel in your shoe and he doesn't. So you're more prone to plantar fasciitis because of your shoe gear too.
I wore the heels yesterday.
Yeah, yeah. You wore them yesterday?
I wore them yesterday, yeah.
Now you think of plantar fasciitis in the feet, but I imagine that can cause pain throughout the rest of the body when we're talking about the things we walk on every single day.
Absolutely, and that, you know, how you walk, the shoes that you wear can aggravate other joints too. It doesn't just have to be the feet too, you know, how you position yourself.
All right, so you injured the plantar fascia, is that what it's called? Okay, you injured that and it's hurting. And now explain what the pain is like for people that may not know what it is.
Typical plantar fasciitis is going to be what we call post-static, so after sitting or resting. So the first few steps you get up in the morning, or if you're sitting at a desk and you go to get up, those first 10 or 15 steps are excruciating.
Like you're stepping on a golf ball.
Something, or a nail sometimes.
Yeah, a nail, yeah.
So what do you do if you have it? What if you all of a sudden are in your years and you're like, okay, I can't sleep at night because my feet hurt, or I am waking up and I'm taking those first steps and it hurts? What do I do?
Well, we talk about free, cheap, and easy. So, you know,
I like that.
That's our motto, yeah.
Things that you can do at home. You can ice, you can stretch. You can get better supportive shoes. You can get over-the-counter insoles. And all of those techniques you can do at home and they're relatively free and cheap and easy to do. It's really those people that struggle beyond that end up in our office. And then you're talking about things like...
Yeah, what is this? What do you have here?
This is an immobilization boot that somebody can wear with severe plantar fasciitis, so they can put this on and it limits ankle motion. It limits the amount of stress on the bottom of the heel. So that's one technique. You know, cortisone has become a mainstay, injections in the heel for plantar fasciitis.
Now, if you get plantar fasciitis, does it heal over a given period of time, or do you have it forever?
Yeah, it's generally a temporary condition.
It is.
So for some people, it's temporary and that'll last a couple of months and it's gone. For other people, it's temporary but recurrent. So maybe every summer they get it when they go to flip-flops, or every year when they go on vacation they get it, and it lasts for a few months and then goes away.
Okay, so you've taken the precautions, you've tried the different things that are going on, you've tried the boot, you have that, but still it's not going away. Then what do you do?
In extreme situations, and I will say plantar fasciitis is probably 95 to 97% curable without surgery, but a few people go on to surgical intervention. And in those cases, we'll clip a little bit of the ligament.
So yeah, what do you do? You just remove it then, or?
No, so I do it under a scope, an arthroscopic procedure, where you make a small incision and we just clip a little bit of that ligament to allow it to relax. But we're also taking a chronic issue and we're making it acute again. The body deals with acute problems much better than it does with chronic problems.
It does. And how much downtime is there for something like that?
We put you in a boot like this for 2 to 4 weeks after surgery.
Okay.
Would you consider this one of the most common foot ailments that most people
This is by far
experience?
the most common thing that I see in the office every day, and I only treat feet. So
Yeah.
Wow.
All right. So your foot and ankle, is that your specialty?
Yeah,
Okay.
yeah.
And which location are you at?
we're in the Des Moines Orthopedic Surgeon's West office.
Okay.
Yep.
So what do you recommend to individuals to hopefully prevent this happening? You know, besides obviously wearing smart shoes and
I think
taking care of yourself.
I think if you're training for an activity, to do it over a slower period of time and don't try to add miles so fast. I would recommend staying in supportive shoes as much as you can. Rotating your shoes so you're not wearing the same old shoe every single day when you work out. Have a couple pairs of shoes so that shoe can recover before you wear it again.
All right. And you mentioned what stretching, does that help at all?
Stretching every morning, you know, if I'm 50 years old, putting my shoes on is stretching for me in the morning. But most people should stretch every day before they exercise, and you really should stretch when you're done exercising.
And it includes your feet.
It includes your feet, yeah.
Never thought about that.
I love that. I love these are all things we can do at home and very inexpensively, like you said, doctor. But if we need a little extra assistance, and you can see there's some non-surgical treatments that you were recommending today, all great advice. But of course, if we need to take it to the next level, we can come and see you. Wonderful.
There's what we're talking about over on West Town Parkway, over here in West Des Moines, 224-1414. Really easy to get a hold of you. Thank you so much. Again, this is an ailment that I'm sure a lot of people are going to be dealing with. If they haven't dealt with it already, chances are real good they will be.
Yeah, thanks for having me.
Thank you, Lee. Appreciate
There's
you
some things
stopping
we
in
can do
today.
about it.
Yeah,
we appreciate
appreciate
it.
it.
Thank you.
Thank you so much.